Welcome back. You're still watching Sunrise at Sea right here on CTV. My name is Apollo Sarah, and we continue the conversation from the Twitter jabs in the first segment, and we were discussing maternal health care services. And joining me in studio today is Mrs. Martha Osiro,
Yes.
and she is a healthcare manager,
Yeah.
not a doctor, but a healthcare manager. So she manages doctors. Good
Yes.
morning.
Good morning.
Happy New Year.
Thank you.
And thank you for joining me.
Thank you for having
It's
me.
wonderful to finally meet you.
Yes.
I'm glad that you could make it. So reports did say that that's the Uganda Bureau of Statistics did report that the maternal mortality rate dropped from 438 deaths per 100,000 births in 2011 to 368 deaths per 100,000 births in 2021. For a lot of people, they could say, oh, this is good. This is a good thing. But it's still very high above, the world level that it should be, and that is it's as low as 152 deaths per 100,000 births.
Yes.
But are we doing enough, even though we have been able to, tremendously and evidently reduce it? Are we doing enough as a country?
I think we're trying, but there's a lot more that needs to be done. Like it's very tricky to stay with statistics because these are human lives, and
Yes.
there's a whole different side that people sort of negate when they look at statistics.
Yes.
I, for one, I have lost quite a few children. I have
Yes.
miscarried 5 babies.
Yes.
And I was in the Western world. So when this happened, I was in the US. And even though those babies that I lost were a number, still personally, it was
They're not
very,
just
very
a-
difficult.
Yeah.
And so for me, it's very hard to say, wow, even though the numbers are going down, not to take it from a personal angle, that this was a life. This was a mother who carried a child and lost the baby. This is a woman who died while giving childbirth. And for me, because of that, I say we still need to do more.
Yes.
We cannot just relax when numbers go down and we say, yes, we are doing a great job. We need to keep working. We need to we should have 0
Yes.
deaths, and that should really be the goal.
Yes. Well, the government of Uganda has gone ahead to increase and build a number of healthcare facilities and services. The number of midwives and nurses registered with the Nurses and Midwives Association has also gone up, and there are more specialized people coming in. Where can we improve in besides just building more facilities and training more healthcare workers?
It's always nice to have facilities, but how do you get there? That's the area of improvement.
Yes.
And I've worked very hard to try to have access to care improved. And then also the reason why many women die during childbirth is because they don't access healthcare facilities. They still believe in traditional births, giving birth at home. And because they feel that sometimes the care that they get or the compassion that they get
Yes.
at the hospitals is not adequate. And
Yes.
so for me, it is a plea to the healthcare workers to have a better attitude towards people, more compassion when they're giving birth. And that's what I find that is very different. The attitude needs to change of some healthcare workers. I'm not saying everybody's like that.
Yes.
But the reason why women don't seek help at healthcare facilities is because of attitude of healthcare workers. And so that needs to improve. That needs to improve. They need to put themselves in that woman's position and feel and be more compassionate towards them.
But see, this is the thing. A number of the midwives and nurses are mothers themselves. So when the ladies come to hospital, the mothers come to hospital to give birth, they're like, you're exaggerating, you're being dramatic. It is not that painful. You're not the first one to have given birth. So should these health workers be put under training? Should there be penalties put on them, say when a mother complains that my midwife or this nurse mistreated me?
I don't think being punitive is the way to go. I think everybody has, there needs to be more training and more understanding. Everybody has their own threshold of fame. You can't say that your experience is my experience, and so that knowledge. But I think healthcare workers are really trying, and I believe the system sometimes is overwhelming, and putting yourself in their position where they have to take care of so many mothers, you almost become numb. And so we need to somehow offer training, offer services where midwives can sort of let it out and also learn how to be a lot more compassionate. I don't think they do it on purpose. I just think they're overwhelmed.
I think. Sometimes. So besides the government, you said besides us leaning and leaving everything to the government, what can we do as individuals? And you did mention that for you, this is something personal for you. You know, maternal mortality and child mortality, something personal to you because you have suffered loss. And you did come and start a very wonderful initiative. I do not want to tell you what it is. I'll let you speak.
Okay.
What is it that you did?
Well, in the first lockdown, I'd been working with Ministry of Health. I'd been helping support the policy so that the government can have a direction of which way EMS services should be conducted. So I was working very closely with our wonderful commissioner. He's called Mr. John Baptiste Wanyaye, and the team at the EMS department. So I also had a colleague of mine, a very close friend, Dr. Joseph Kalanzi, who is, I call him the grandfather of emergency medical services. And so we had been discussing earlier on from 2015 as I was a manager at Aga Khan on how we could improve emergency care in the country. So in 2017 we got the opportunity to start working in that area. But fast forward to 2020, the first lockdown. You remember everything was shut down, there was no movements. And I remember seeing a segment on the news about a woman who was trying to give childbirth, and she was trying to get access to the hospital, and she died giving childbirth. That thing haunted me the whole night, and I was like, I have to do something. This cannot go on while we're just watching. And we can't always just lean on government. They're already busy enough with other things. We can't lean on them for everything, but as a citizen and as a person who cares, you can make a difference. Now, we had no money. So of course I called my friend and I'm like, we have to do something. And he says, well, okay, great, let's do it. But we had no money, we had no resources. So we're like, how do we build a station, an ambulance station, where people can call and get an ambulance to get them help? Because ambulances were the only vehicles allowed to move at that point. So I go to the commissioner and I say, you know what, we need a letter so that we can get resources to build this. I couldn't sleep all night because of this woman. So he said, yeah, go ahead. Ask the PS, she'll give you a letter. At first he said, Martha, so many people have tried and failed. I said, but I haven't. And I want to try this as a citizen and try this and fix this situation. We got the letter and we went ahead and started asking for resources. And so many people helped us. The first people to help us was Total, EMP. Then Clinton Health Access Initiative came on, Bill and Melinda Gates, Malteser International. So many people came to help us. But the very first people were my mother's friends and my family. I asked them each for a bag of cement, and that's how we built the foundation.
Oh, wow.
So now we have a full-fledged ambulance station. It's not like a huge big thing, but it's functioning. It's made out of containers, and we've revamped them. But we need more. We need more across the country. This was just an example to show that this system can work, and it is working, and I thank God for that.
Thank God. Thank you so much. Thank you so much. You are definitely a blessing to this country and for everything that you're doing towards your efforts. So how can people help towards this initiative? Because you did say that there should be more stations that place, and I think it's the first in East Africa.
It's a first in East Africa.
Yes.
There's really not an ambulance station in any of the other countries. And Uganda does a lot of firsts, actually, that people don't really know.
Yes.
The first, we were the first to start working on a policy, although we came second after Kenya to get it passed through Parliament. But we are the first in very many things, especially in emergency medicine. And so what people can do, we need stations at each region.
Yes.
What the ministry is trying to do is have a regionally coordinated system.
Yes.
And so when a call comes in from Masaka, it can go to the Masaka station, although this station in Kampala can see what's happening, but it's a Masaka team who should be able to coordinate the ambulance services in that area.
Yes.
And so for me, as showing that when people come together, we can do this. I'm appealing to everyone to start seeing how we can contribute towards other stations around the country so that we can get a coordinated system.
Yes.
So there's 14 regions that we need an ambulance station in. We've started with Kampala. There are other regions that are coming up, but I ask to help, because it can be your family, it can be your friends, it can be another woman
it could
dying
even be you
needlessly.
Woman,
and it could be you.
So how many, aside from Kampala, which other regions are starting to set up an ambulance center?
There have been talks in Hoima, and I believe it's in Arua. I need to verify that with the commissioner. But there are only 2, and yet we have 14.
There are only 2 and need 14 more.
Yes.
So how can people access the ambulances? Is there a charge? Is it free of charge?
It's free of charge. It's free of charge. There's a number. Actually, what we're trying to do is get a short code. Like in other parts of the country, you have 911.
Yes.
We were trying to get 912. And we want people to be able to access that, but I have numbers here I could read out to you where we can reach the ambulance if you need be.
Yes.
I've been a beneficiary of that service.
Yes.
And it has really worked well, twice actually, for a friend. Just recently, the other day, I had a friend's brother who was trying to commit suicide.
Oh, no.
And we got him on time and got an ambulance, and he got care and he lived. And so those are some of the things that they do. They're actually doing an amazing job. Just shout out to all the ambulance teams in Naguru. Thank you so much for the hard work, and the whole department of EMS. Thank you for really doing this work to save citizens' lives.
Yes. So where is it located exactly? Is it in Naguru Hospital?
It's actually in Naguru Hospital.
Yes.
The director, we had gone to a couple, but the director at Naguru Hospital gave us space. He was the only one who really believed in what we were doing and said, okay, go ahead, try. He gave us the space that he had. It was in a parking lot.
Yes.
But that we built something that fit right in there. And so I have the number here. It is 0313 313 600. 0313 313 600.
Yes, and we'll be sharing those numbers right later on our screen, and also on our social media handles, on our Facebook, on our Twitter, on our Instagram. And if you need an ambulance, you can definitely call. Don't forget, it is free of charge. So before we go, any last words, any parting shots? Yes,
for me, and thank you for doing this on maternal health. Just a reminder that women are still dying, and we can do more as citizens.
Yes.
We don't have to always wait for government to do things. We can take the initiative in our own hands and do something and join and partner with government.
Yes.
We built this with Dr. Kalanzi, and we gave it to government, and they're running it.
Yes.
And so let's continue to do that as citizens. Let's continue to build the services to save lives.
All right. Before I let you go, we have been speaking to everybody except for the expectant mothers. So do you have any parting shots for them? Because at the end of the day, it is their health, and their health is their responsibility.
Yes.
It is their responsibility to, to stay alive and to make sure that their children are going to be delivered in a safe environment. So what would you like to say to any expectant mothers watching us today?
I would say go to the healthcare facilities and get the antenatal care you need, as well as when it's time for giving birth, go and give birth in a safe healthcare facility. There are many myths that the health workers are not good or they're unkind, but it's not that. Just simply go, and if there's somebody's being unkind, ask for another person to serve you.
Yes.
But go there and give birth safely, because it's not only your life, it is the life of the person you're carrying.
Yes.
And you never know this life that you're carrying, what they're going to turn out to be.
Exactly.
So don't take chances. Don't minimalize this. Go and give birth safely in a healthcare facility.
Yes.
And if anything is wrong, don't wait.
That's right. Thank you so much for joining me.
Thank you so
Mrs.
much.
Osiro, it was a pleasure talking to you. I am very delighted and happy with what it is that you're doing.
Thank
you. Like you heard, she is calling upon everybody to contribute to this cause. It is not only about just, maternal health, but everybody, like she shared a friend of hers who was, the ambulance was able to reach him on time. So this helps everybody, and let's work together to make this work. There are 3 causes that were attributed to high rates in maternal mortality, and that is delay to receive medication, delay to receive maternal health services, delay to get to the healthcare centers, and delay in what's the other one? Delay in, reaching the healthcare service, delay in getting your treatment, delay in reaching the healthcare center, and delay in administering the, required treatment. Yes. Those are the 3 causes that were attributed to high rates of maternal mortality rates in the country. And like also what Mrs. Osiro did say, this is a joint effort, so let's come together and help each other. Don't just wait for the government. Well, this is the Twitter Jabs, and thank you so much for joining me.
Thank you for having me.
Stay tuned to Sunrise at Sea. Coming up is our wellness and lifestyle and beauty segment, and I will be and you know what we do here every Friday. It is hit or miss, and we will be deliberating on some of the freshest and trendiest male fashions around the world. Stay tuned.